This is Physician Spotlight, where we highlight top physician specialists and their technologies in the Mid-Michigan area. If you can't hear me right now, or you know anyone who has any hearing problems or any ear-related problems, then you'll want to take note today. Because we have with us Dr. Wayne Robbins, who is going to talk to us about some of the special procedures that he has brought in our area that can help those very issues. So welcome.
Thank you. Thank you, Nicole.
Tell us a little bit about these procedures that you've brought in the area.
Sure. We've seen in the last 25 to 30 years some great advances in the field of hearing and ear problems we call otology. A lot of this related to better optics and better technology that's out there. But we've come to a point where we have some really fantastic procedures that affect many different areas of the ear.
Would that be any age? I mean, I know there's children that have a lot of ear.
We definitely see this in young children, and some of these even congenital. Even another portion of patients that I work with are people that are born with congenital problems, maybe without an ear or with an ear that doesn't hear properly, that they're born that way. A second area that a lot of our efforts go towards is balance and dizziness problems. The inner ear has some of the responsibility for balance, and so don't the eyes and some of our joints. They work collaboratively with the brain to figure out where we are in space. When we lose that ability, we call that dizziness. Probably a very common one, maybe many people watching this have experienced, is called benign positional vertigo. This is a very short duration dizziness that occurs maybe when you roll over in bed. Something that now we can treat fairly quickly, usually resolve this in 1 or 2 office visits.
Now I understand that you have a cochlear implant that you do, and I don't know if our viewers even understand what that is, so maybe you can talk a little bit about that.
Absolutely. It's a way that we can help people who have lost their hearing completely, people who have become deaf over their life, to bring hearing back to them.
Wow.
And it is a wow when you see people that have heard their whole life and due to infection or car accident lose their hearing. It becomes a very lonely world for them.
How much of their hearing can you bring back with that procedure?
Most people that we're going to implant have lost enough hearing they can't talk on the phone. They don't have to be totally deaf, but they're near deaf. So they can't talk on the phone very well and would have difficulty in any noisy background. And when we're done, most of them in a quiet situation like this would get close to 90% of the words correct at this volume. And even in noisy situations will do very well.
Now your practice is pretty full scope, I understand?
We have 2 audiologists that work with us that provide hearing aids when that's appropriate, through a full range of other implantable things like BAHA, osseous integrated implants. I have 2 partners that I work with. They have interests in other areas. So one of them more into head and neck surgery, some of the cancers and things that we deal with in our area. And my second partner more interested in some of the plastic surgeries that we do. So as a whole, we're able to offer help for anybody really in the ear, nose, and throat problems.